Hey, Dr. Rogers Dow here today with Freeport Family Chiropractic and Acupuncture. Thanks for joining us. I hope you're having a great day. We are going to talk today about spinal decompression. You may have heard that before, or that term, spinal traction. So, what is it? Basically, it is a non-invasive, a non-surgical, very safe approach to spinal therapy now, where we basically take pressure off the spine by providing an axial force where we are taking the vertebrae and pulling them this way. So in essence, we are increasing the spaces between the vertebrae, causing a decompressive force. So, what else does it do? Well, when it does that, we take pressure off the disc, we take pressure off the nerve root, where the nerves are just coming out of the spine here. We increase blood flow to the area. So in essence, we're causing that environment to have a better healing environment, giving more blood and oxygen and nutrients to that area. And fourth, we're decreasing muscle spasms. So those are the things that we're accomplishing when we are using spinal decompression. So who would be indicated to use this type of thing? So a lot of the people that we see would be those who have degenerative disc disease, something called foraminal stenosis. A stenosis is a narrowing of a canal. So for instance, as that nerve is coming out of that hole there, that hole is called a foramen. So foraminal stenosis would be a narrowing of that canal. Or there's also called something called spinal stenosis. That would be the narrowing of, that's the spine here, that hole right there, as it closes off. That would also be a potential indication where we can use spinal decompression. Something else could be disc herniations. Those who are suffering with sciatic problems and leg pain, a lot of radiculopathy. And then also too, something called facet syndrome. The facets are the joints where those two vertebrae approximate and basically almost touch. So if I get this good looking vertebrae here, where the disc is nice and big, when we look at the side here, we have this bone here from one vertebrae and then this bone here from the top vertebrae. So when I pull those apart right there, you can see that's the joint right there. That is called your facet. So when those discs start to degenerate and all of a sudden they start to thin out, that disc, or the facet in the back can start to have a lot of extra stress and strain on it, inflammation, and causing a lot of pain. So they would also be a potential candidate for spinal decompression. So in essence, what we're doing is providing a graduated tension on the spine, where we're elongating the spine, and it's a very specific, very concise, and very consistent repeatable movement, because basically once we hook you up to the table, and then we program the computer for what poundage we want you stressed at and pulled at, that is very reproducible time and time again. And from there, that's how we start to see how you're improving, and we go from there. So if there's anything else that you think you may have for questions, by all means, keep them on, give them to me on this thread. I'll try to get back to you as soon as I can. If you have any questions, if you think you may be a potential candidate, or you might know someone that might be a potential candidate, by all means, have them give our office a call. Be glad to talk to them. And thank you again for your time. And again, we will be definitely discussing this topic in the near future. It is a very big topic, a lot more to go over. But I appreciate your time today, and thanks a lot for listening. Bye-bye.